So, first of all, hello everyone, and I want to thank Mr. Charlie Ekubi for inviting me in this amazing place, and of course is super staff for all the organization, okay? And this is the third Congress in which I participate, and the first was in Paris in 2017. Here you can see me with Charlie, and the second was last year in Lake of Como, and the question is, who's that man? The same, Charlie is everywhere, okay? So, this is my short curriculum, but we have not a lot of time, so I don't want to lose time to speaking about myself. Just I want to underline one thing: the European Board of Orthodontic Certification, that has been for me very hard work with a great satisfaction. So I don't want to lose time to speak about myself. These are my dear friends. They took the same certification with me, and the big person in the middle of this picture is my dear friend, Dr. Laspos, that now is the president of the European Orthodontic Society. And this is my certificate. So, which is the argument that I'm going to talk to today? The title is Ideal versus Real Aesthetic Goals for Different Clinical Patterns with the Genius System. And is quite similar to what I've done in the last year in the Lake of Como. So the same argument, and I will try to underline some concepts that for me are fundamental, and by showing some clinical cases, and but of course, if you want to deepen in these concepts, you can subscribe for this course that will be held in Paris the next 8th of December 2022. So I will wait for you in Paris. And so let's begin with the first case. The first case that I'm going to show you is Andrea. I'm really fond in this case because I showed like a case, like a progress case in my first Genius Summit in Paris in 2017. But for me, and of course, a few months later, we finished with this case for the joy of the patient, of course. And it's a very good case for me because it allows me to introduce the way in which I normally work in my office. So I love to divide the problem of the patient in face problem. For example, in this patient, you can see the thin lips of the patient, the retrusive lips, respect of the true vertical line. The retrusive lips, in fact, we have the nasolabial angle that is greater than normal. And I agree with my colleague Colilat, we have to think about, we have to look our patients from a facial point of view. Macroaesthetic is fundamental for our treatment plan, for our goal. So he has a gummy smile, very important, and she has reduced the mandibular in superior incisor projection during smiling. And these are the dental velar problem. So you can see the intraoral photos, and of course these are the digital models. He has class 1, and it's not a problem, but you have to maintain if you treat this patient. If you lose the class 1, of course, is a problem. And we also have alveolar lens discrepancy. He has a severe crowding in the lower arch, and small laterals. The 12 and the 22 elements are small microdontics. And overbite, he has overbite increased 10%, complete overbite. This is the panoramic, doesn't show anything special. and the lateral, the same things. And then we arrive to the final data, so the cephalometrics data. It doesn't show nothing special for me. It is a skeletal class 1, but it has retroclined upper and lower incisors. And in a case like this, especially when we have small laterals, sometimes it's really important to calculate the Bolton index, the anterior Bolton index, to know which is the problem. In that case, we have much more animal substance in the lower arch than in the upper. And so it's another important picture for me, because I always do it for my patients, now really for the patients, for the critical patients in which I have some dubs, in which is the best treatment to do. However, to simplify, for example, problem list of the face, we have the thin lips. He has the thin lips, and I have to identify the objective. Of course, will be to increase the lip thickness, and the treatment solution probably will be to procline incisors. And if you procline incisor, a good treatment solution could be a non-extraction treatment plan, of course. So which are the objectives of these patients? To correct severe deep bite and gummy smile, correct lower crowding, improve the projection of the lips, and maintaining class 1. And so, which could be the ideal treatment plan for these patients? Because if we look the facial profile of this patient, which could be the ideal treatment plan? He has big nose, long nose, he has the retrusion of maxillary and a little bit retrusion of mandible. So, ideal treatment plan could be, of course, surgery with bemaxillary advancement and rhinoplastic for the nose. But you know, in a realistic treatment plan, patient like this with this kind of problem doesn't want surgery. They refuse the surgery always. So, which could be the real treatment plan? We have to just to move the teeth. And so, intrusion of upper incisors, correction of curvus P, of course, and to solve the lower crowding, we have 3 possibilities. Extraction of lower incisor, APR, of course, and proclination. And, of course, procline upper incisor for the problem of the upper lips. So, what about the treatment plan? And again, the very best thing for us is what the patient looks for. The needs of the patient are the most important things in our building treatment plan. So, in this patient, I decide to go on with the Genius system to extract the 41 elements and to do 2 veneers and for the 12 and the 22 elements. So I start with Genius. Sorry. Yesterday night I lost some voice on the boat. So I start with the treatment, I start with the bonding in the upper arch in a case like this. And another important thing that I want to underline to you is the positioning. In this case, the patient has gummy smile. The position, the strategic positioning of the brackets in this case, really near to the incisal margin. And I'm speaking, of course, about the upper incisors. To get intrusion. So this is a very important trip. And another things that Dr. Colelat has underlined is that we need, of course, to have we need a brackets with a very good torque information, with a very precise slot. And Genius has a very good performance from this point of view. Okay, so we start with the treatment with the 14 and 90 arch in the upper, and just 2 months later we have this result, and it's good. And then we go on with the treatment. We have now the 1425 arch in the upper arch to begin to give torque to our upper teeth, and in the inferior arch we applied a light coil. We made a distraction of the 41 and to begin to close the space of the extractions from the beginning, of course. 5 months later, this is the situation. I try to go fast. And now in the upper we have the 1825 that is fundamental to give more torque to the upper arch, and the space in the lower arch is closing. So everything is going well. 6.5, situation is quite similar. Okay. Okay, and finally I create the space to engage the 31, and now the arch is working also in this element to complete the alignment, of course. After 9 months we have this situation. So we put the braces on the 37 and the 47, and this picture is really important because, of course, if I want to do veneers at the end of the treatment in this patient, I have to create space laterally to the upper laterals. And in my office, I do the veneers. My second patient is veneers and aesthetics dentistry. So in that case, I prefer to create the space laterally to the lateral, because it's easier to create a correct prosthetic emergency profile. So it's better to create space laterally to the lateral. So in this picture you can see the coil slightly activated to create this space. Let's go on. 10 months. Everything is going well and the bite is opening, and these pictures are good because show exactly the space, the creation of the space that I need. Other pictures of this detail. And this is the 9-month comparison of the patient, and the profile seems to be better, of course, but of course he has the braces. The smile, also the gamma smile seems to be a little bit better. The profile and the torque. Okay, the torque is the torque improvement is evident. Okay, now I go fast. Look at the inclination of the frontal incisors that completely changed. Okay, and finally we have this. This is after 16 months, so a very short treatment. This is the end of the treatment, and you can see the space that I create to do my veneers. Of course, now this is a very critical point, because now the patient I have to do the veneer, so I have to maintain the space, and so now is wearing, of course, an X6 to maintain the space. This is my preparation, very light preparation, because we need animal, of course, to get a very good bonding of the veneers. These are other details. This is the digital setup. It's quite similar to what I get to the end of my treatment. And this is the final photos with the veneers. You can see the correction of the overbites and the maintenance of the class 1, molar and canine. And so this is Andrea at the end of the treatment, is completely changed, and of course the smile is really good now. And so the comparison, we have a better aesthetic smile, of course, we have small corridors, and we have less gum in the smile. But remember the strategic positioning of the braces before we start with the treatment, from the start of the treatment. So this is the comparison between the digital setup that I've done to the final photos. It's quite similar. Okay, I go quickly with this, and the comparison of the occlusal upper with the digital. And so this is another point really important. In the 2017, I didn't make any digital setup, but in my opinion now, in a case like this, in which you have some dubs, extract, non-extract, a digital setup of the malocclusion could be a very good help in to gain the right decision. So I show you the digital setup without extraction. And of course, without distractions, lower incisor will procline a lot. And this is the digital setup with distractions of the 31. It's really the same of what I done. Okay, and of course, all we know that in that case, I consider the periodontium of the patient, and so I prefer to make extractions. But if you make a lower incisor extractions, you know that is a really complex case, because probably you will have some problems in to obtain a very good overbite and overjet. But this is an overjet. But this is a very complex argument. So I wait for you in Paris to deepen this concept. This is the final panoramic, and this is the final tele, and so in which you can see the good torque expression. Okay, this is the second case that I want to show you. Is Giada, is really a pretty girl. Giada is a girl of 13 years old, and look at the facial photos. She has a poor smile, irregular smile, and look at the strain of the perioral muscles, and she has incompetent lips. And she has a profile completely different from the patient that I showed before. She has convex profile, thick lips, crowding, of course. These are the intraoral photos that show the class 2 molar and canine, and severe crowding in the upper arch and in the lower. Thin periodontium. Look at the periodontium of your patients. These are the cephalometrics data, and the most important things are the skeletal class 2 and the hyperdivergent of the patients. It's a very important thing. This is the panoramic, nothing special, and we have our balance, where to put the stones. No extractions. Well, in that case, the stones for the extractions are a lot. So strain of perioral muscles, severe upper and lower crowding, hyperdivenger pattern, thin periodontium. And what about the stones to put in the plate of the non-extractions indications? Nothing, just the tears of the mother. Everybody knows that the extraction treatments sometimes are a problem, especially for the father and the mother, okay, not for the patient. So, which could be the ideal treatment plan for this patient? Look at the profile. She has long face, she has convex profile, she has a thick lips, she has the strain of the perioral muscles, so extractions, treatments to improve aesthetic profile, extraction to solve upper and lower crowding, extraction to correct class 2, and again, which could be a realistic solution for these patients. The same, of course, because she doesn't have any macroaesthetic problem. She has a lot of, she's a really a pretty girl. So in that case, extraction treatment to improve aesthetic profile, extraction to solve upper and lower crowding, extraction to correct class 2. So, ideal, in that case, is equal to real. In some cases, sorry, too much effects. In that case, in some cases, we have both. Okay, so you can treat this patient in an ideal way, but it's equal to real. Okay, so my treatment plan has been extractions of the first premolars in the upper arch and the second premolars in the lower arch in order to solve upper and lower crowding, in order to correct class 2, molar and canine, in order to improve the profile of the patient. And this is the very important thing in this case that I want to underline to you, is what about transversal? Look at the inferior molar. Look at the negative torque of the molar, of the inferior molar. He has a very deep curve of Wilson. So if you imagine to make the straighten of this teeth, you need expansion even if you are going to do an extraction treatment plan. So remember this. Look at the curve of Wilson, because normally we think about rapid palatal expansion when we have mono or bilateral cross bite, when we have severe crowding, but it's not the only points for doing a rapid palatal expansion. So remember this, and I found some scientific articles for you that you can read, of course, and think about, look at the curve of Wilson of your patients. So we have our genius system, progressive engagement. We made the extraction. So I'm going a little bit quickly. Now we have completed the alignment. We are in the working phase with the stainless steel 1925 posted arch. And here the system is complete for the working phase. So we have class 2 elastics on the posted, from superior posted and molars inferior, and we have the chain to close the space in the lower arch. And then, at the end of this phase, working phase, sometimes I use also intercalf elastics to get a better occlusion.
Andreas, can I just interrupt? The lower wire on your working phase is which side?
The same. 1925, yeah. Yeah. And here we have the end of the treatment after 21 months. It's a very good result, and I'm happy, and of course the patient is more happy than me. This is the comparison before after. Look at the periodontium at the end of the treatment. It's very, very good. Nice. Occlusal comparison. And this is the extra oral photos with the smile of the patient, of course. And the comparison, the smile before and after. And I'm really happy. But the point that I want to underline to you is probably buccal corridors are properly filled thanks probably to the rep. So think about this, okay? And this was an old picture to underline all the points that I showed in the Lake Como Congress. So what we have to do in the finishing stage to get the best result we can. But I don't want to bore you with this now. So the last two cases, progress case, but just to emphasize the concept that I showed in the first case, in which I put the braces in the deep bites in a very incisal position. The concept is the same. So we have two boys, Alessandro and Alberto. They have very different facial type. So Alessandro is a deep bite, short face, and Alberto is long face, open bite, completely different profile. But when we see their smile, we can see the gummy smile of Alessandro, and we can see not so many teeth in Alberto. The profile, the same, of course. And here we have the intraoral photos. Alessandro has a very important deep bite, and of course class 2 cusps and spaces. It's a very complex case that I showed in Lake of Como. And here we have Alberto. We have an anterior open bite, canine to canine, and he has also a little bit slightly crowding in the upper and lower. And the question is, is there a strategic positioning of braces that helped me to correct malocclusion right from the start? Okay. Yes, of course. This is the positioning of the braces in Alberto, and look at how much gingival I put these braces both in the lower and in the upper arch to get the closure of the open bites, to correct the open bites from the start. So gingival bonding is mandatory in that case for me. This is Alberto in the progress. Now is wearing a 1925 arch. And this is after 7 months. This is a progress case, but I'm solved the big problem of the patient in 7 months. Just to follow this strategical positioning of the braces. It's a really important thing. To be continued, of course. And of course, I want to show you quickly the end of Alessandro. The reasoning is always almost the same, but on the contrary, of course. So I put the braces in a very incisal position. Look at the arch from the posterior to the anterior, and incisal bonding to get intrusion. He has a severe gummy smile. You can do it. And this is the progress with the end of the case of Alessandro. It's a very good case, and the deep bite completely solved. Okay, the smile of Alessandro. Okay, so my take-home message is talk to patients for a better understanding of their needs, so your treatment plan will always be a success. This is the very important thing that I want to underline to you. Okay? Thank you guys for attention.